Well, good morning, everyone. It is still a couple minutes before noon here, and I believe it is around 9 a.m. on the West Coast. We have Dr. Carrie Jones, who's a naturopathic doctor, as well as a fellow of the American Board of Naturopathic Endocrinology, and also has an MPH degree, joining us from Portland. Really happy and grateful that she's here today to talk about hormone Q&A. And we're going to talk for a few minutes about the usual things, CIH, community updates, and then we'll launch into hormone Q&A, which I'm sure we're all excited about and grateful that Dr. Jones is here. So welcome everyone. Thank you for sharing your lunchtime with us, and thank you for coming in today and spending your valuable time with us. So we'll talk first about community updates. In Maryland, we're holding steady on the cases. Nationally, unfortunately, there are about 200,000 deaths. Then there are still no treatments approved for coronavirus, but as we've been talking about every week, there's many ways to optimize the immune system so you can be the driver, the CEO of your own health. There's lifestyle factors. Obviously, sleep is huge. Mindfulness is huge. Connecting to community, walks in nature, what you call Shirin Roku, I think in Japanese. Vitamin D is helpful to both. Also associated with prevention of COVID, even after exposure. Acupuncture, red light therapy, we're big fans of the Juve here. IV vitamin therapy, especially Immunoboost. And then actually a clinical trial is being done on low-dose naltrexone with COVID as well. And then in functional medicine, looking at optimizing the gut, the detox pathways, and the hormones, which we'll talk about today. There are 3 big trials going underway. One trial has been halted in the US because of serious neurologic adverse reactions, including transverse myelitis in 2 women in the UK. So the US has decided to halt that trial, but 2 others are also still underway. And so we're gonna still be looking at that obviously every week. We do have a flu vaccine here available now, mercury-free. We do recommend, if you do elect to do this, to optimize sleep, optimize the gut microbiome, and then also support immune system activity. And we do have IV nutrients here that you can do 1 to 3 days before or after the vaccine to help you and kind of help your gut, etc. So we're going to take a little bit of a bridge across to the hormone world again today. I just got this off the internet, so hopefully you enjoy that. And then Liz Reese is going to be talking with me, and we're going to be doing some group visits, a 3-part series that's virtual on de-stressing the nervous system, how to reduce stress, how to rebuild resilience using heart math. So really excited about that. And if you haven't signed up for that, please let our admin team know, and we can register for that. Here's the upcoming schedule in October that you can see here. We have an immune panel next week. We have Ayurveda with Dr. Khalsa, Sirachan Khalsa, as well as the next ones after that will be on psychedelic mushrooms for hard to treat mental and emotional disorders, and then osteopathic manipulation with Dr. Kaiser in late October, every Thursday. So thank you for joining today. I have a few fun slides, and then we'll talk about a little bit more hormone Q&A with Dr. Jones. So hot flashes or global warming, I don't know, maybe it's also the wildfires. We have to run some tests. This doctor is very worried about this person's hormone levels. They're a little bit hairy. And then also we try to balance the hormones. We need to get more of them over to the other leg or to the other side. So we need to test labs sometimes to really understand in a precision way, what's happening with the stress levels. And when all else kind of, goes, then we have to think about neutralizing the stress hormones with a very scientifically evidence-based treatment, which is chocolate. These are all things that can be helped with hormones. So Dr. Jones is internationally known with her work in hormones. She's a naturopathic doctor, I believe graduated from National University of Naturopathic Medicine. Dr. Mark Davis is also in her practice. Dr. Jones, I believe he graduated from there as well. As I said before, she's a naturopathic endocrinologist and has an NPH, and she's now currently the medical director of Precision Analytical, which we actually use a lot using the Dutch test, and some of you may have done that. Just before we start here, and I'll stop sharing here, we know that Dr. Jones is a well-recognized doctor. However, this is not considered, our Q&A today is not considered medical advice, and we hope you have a lot of fun here today, as we will definitely do that. And there will be a replay on this, and this is also being broadcast on Facebook as well. So welcome, Dr. Jones. Thank you for being with us today.
Oh my gosh, thank you so much. I was watching your other upcoming Thriving Thursday, and I was like, oh, I want to go to that one. Oh, I want to go to that one too. Oh, that one looks good.
Yes, very juicy upcoming ones. Really appreciate that. Yes. So, so I think this is going to be a little different than we've done before. So, those of you who are attending today, and it looks like we have a bunch of people attending, please write your questions in, because I have a bunch of questions to ask Dr. Jones. But let's start with some of the listeners, and you can type in, or I think you can also do the raise your hand thing on Zoom, and basically type in some questions that you have about hormones, or about, I guess, other parts of natural health. I think we can talk first about what the Dutch test is. So let's talk about that. So Dr. Jones is the medical director of Precision Analytical. What is the Dutch test? Is it a test that is given in the Netherlands? Or tell us about that.
You could have to ask that question a lot.
Yes.
It's an acronym, right? It's an acronym. So it's dried urine test for comprehensive hormone. Everyone goes dried urine. That's weird. So basically, you take these pieces of filter paper and you urinate on them 4, if not 5 times throughout the day, let them dry, and then mail them back to the lab. And that's why it's called dried urine. But the nice part about it, especially if for those of you listening who've done it before, it's convenient. You do it at home. It's easy to do, and it gives you all your main hormones, your sex hormones, your estrogen, your progesterone, your testosterone, your cortisol for males and females, but then it tells you where it's going. So a lot of women especially will say, I have estrogen problems. Could I be at risk for estrogen related, issues? And we can give you the pathways, like, well, here's your estrogen, and here are the pathways that it's going down. Some of the pathways are better than others. Let's just say that. And that comic that you showed of the person who was super hairy, all I kept thinking was the 5-alpha reductase. So there's some people who say, I'm getting chin hair, I'm getting like hair on my neck, I'm getting hair on my belly. Like, what is this hair? There is a pathway that testosterone can go down in women that can cause that hair to grow more than we want. It's not exactly the kind of hair that a lot of women want on their body. But for men, that same pathway can cause prostate issues, and that same pathway can cause actually male pattern baldness. So we get a lot of info out of the Dutch test.
Right. If reductase enzyme activity is too high, it could cause different things for men and women. This is something that I know we have different people here in terms of like their knowledge and understanding of the Dutch test for hormones. So this is something I wasn't going to ask, but I think it's a good thing to just kind of start off with is, well, what is a hormone? Why are hormones important? We know about gut. It's sort of like intuitive. Oh, belly hurts, bloating, there's some gut issues. Yeah. Some people might be having, brain fog, so then they might go to a neurologist or something like that. But what are hormones exactly, and why are they so important for our health and wellness?
So that's a great question. And honestly, I love that we're starting out with that. So hormones are basically just messengers. They are literally messengers, and they get released from a gland in your body, and they are sent out to a part, like what we call a receptor, the docking station. And it's to do something. It's to activate something. It's to turn something on. So like cortisol. Cortisol is a messenger hormone for stress, or it's a messenger hormone to reduce inflammation, or it's a messenger hormone to help you manage your blood sugar. Estrogen is a messenger hormone to help with furthering the menstrual cycle, right? Helping with fertility if you're looking to get pregnant. For women, it helps with skin health. Men, testosterone. Like all these hormones are basically just messengers. And so they're not on all the time. They follow a rhythm. A lot of them do. And so they can be totally, like your comic, they can be totally out of balance, off when they are supposed to be on when they're supposed to be off, or maybe just too much or too little overall.
So we don't want to all look like porcupines, I guess, like that comic.
We do not want to all look like hairy porcupines. That's true.
Thank you for that overview, Dr. Jones. And then we have a question from Jennifer here. So she's saying, experiencing menopausal symptoms, having hot flashes and weight gain, the history of breast cancer. Is there anything safe to help for symptoms given that history of breast cancer? Thank you for that question.
That is an amazing question. So when it comes to, if you have a history of breast cancer, obviously the general consensus is when it comes to hormone, like should you go on hormone replacement therapy? The general consensus is that you have to be very wary. So depending on the research you read, some say it's by time, like how long it's been since you've had breast cancer. Some say if you've had an estrogen receptor, progesterone receptor positive, because some women have not. Some have had one or the other. Some say never to do it, never do hormone replacement. And some say don't do hormone replacement, but do other things like adrenal support, address the gut, nutrients, vitamins, stress relief, things like that. And so there's a lot that goes into, I have a history of breast cancer. What can I do because I essentially don't feel good and I'm having all the menopausal symptoms? So we definitely look for alternatives if you can't or shouldn't be on any kind of HRT. So it's hard to say on a webinar, right? It's hard to say on a Facebook Live, like, oh, you do this one thing, it's the magic key, because a lot of it entails your current health, your past health, lab work, things like that.
One of the things we do in terms of hormone replacement, which we're going to talk about today also, is we do routinely, as a rule in our clinic, recommend using the Dutch test to follow, post hormone replacement therapy for safety, to make sure the estrogen detox pathways, the testosterone, everything's kind of getting detoxed appropriately.
Right, absolutely. When it comes to estrogen, like I was saying earlier, there are three pathways, 3 steps, I should say, to once your body's done with an estrogen, where does it go? So step 1, step 2, step 3.
Mm-hmm.
And some of those steps can turn tail and go down the wrong staircase. And we don't want it to go down that staircase. That could lead to maybe an increase in cancer risk. And so by doing the Dutch test, you'll get 2 out of 3 steps, just like Dr. Wong was saying, and we can help you get you back on the right pathway and hopefully lessen your risk.
Yeah, so I mean, in terms of things that could be safe, I mean, safe is a relative term. If someone has a history of breast cancer, especially if the estrogen receptors are positive, then it's even hard to say to give phytoestrogens. Is that correct?
So, well, honestly,
what do you think about that?
Mixed. I've actually read research that says phytoestrogens are generally considered safe, but the studies need to be bigger as far as the amount of women in them. Whereas, other, of course, practitioners feel no, even with a phytoestrogen, because a phytoestrogen doesn't increase estrogen. A phytoestrogen is a plant. It's a plant, an herb, a food that acts like estrogen. So it will go to the receptor, it will go to the docking station and very mildly turn it on. Where if estrogen is 100, phytoestrogens are much, 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 much less, but still they can very, very mildly affect that receptor. So again, I have definitely read research that says phytoestrogens are considered safer, but you have to take the whole history into account, your current health status into account. It's definitely not a broad one.
I mean, we've also found that acupuncture has been really helpful for postmenopausal. That's another way to help with hot flashes, especially if someone's estrogen receptor positive. That could be very helpful. And then in terms of the weight gain too,
hot flashes, we know it's that one of the big things with hot flashes is we have a stress hormone called noradrenaline. So we know of or norepinephrine. So we know of epinephrine, which is adrenaline, and then there's norepinephrine, which is sometimes called noradrenaline. And what it does is it affects our relation in our brain. So I will often ask perimenopausal and menopausal women, how's your stress? How's your stress been lately? Especially when they say, I haven't had hot flashes and my hot flashes have come back. I'm like, well, how's your stress been? Because when that hormone goes up, that stress hormone goes up, it affects how you regulate temperatures, along with, of course, estrogen plays a big role there. And so if we can work on the stress response with acupuncture, with herbs, with vitamins, with nutrients, with meditation, with heart math, with all of those things, then she may not need estrogen at all. We just have to get that stress hormone to not irritate, and mess with the brain so much.
Yeah, and let's. I think this is something, and I want to get to some of the questions from the listeners too. But as you were saying about the stress, from Amber here, how do hormones balance sleep? And that might be a good chance to talk about the HPA axis too.
Absolutely. So a lot of hormones affect sleep. So the HPA axis is the hypothalamic pituitary adrenal. So basically brain down to the adrenals, and the adrenals make several hormones, but cortisol is one of them. epinephrine or adrenaline, and norepinephrine are some other ones. And so when cortisol, adrenaline, when you're running high on them at night, that can definitely affect sleep, because cortisol is your daytime hormone, whereas melatonin is your nighttime hormone. So when your daytime hormone is up at the night, then it could definitely cause you to not be able to fall asleep, not be able to stay asleep.
It's all
Another big,
those cell phones.
cell phones, TVs, tablets,
Yes.
laptops, right? We see it with entrepreneurs. We see it
Mm-hmm.
with parents. Parents put their kids down, entrepreneurs eat dinner, and then they get that second wind and they keep going. They're like, okay, finally, I have a couple hours at night to finish up, to get stuff done. It's quiet in the house, and they gear themselves up, and then they can't sleep very well as they go into the nighttime.
I never do that.
Yeah, me neither.
Yeah,
Yeah.
all need to work on sleep. So hormones. So Amber, I'm curious. Is your question about hormones balancing sleep? Is part of it's about lifestyle, right? Part of it's about making sure that cortisol is high during the day, so you can do things you want to do during the day, so that by the nighttime, when the melatonin starts to rise between 8 to 9 p.m., that cortisol starts to drop, and a inverse, relationship, which then you can have people sleep. How does estrogen and testosterone and progesterone? I'm just curious about those. How do those affect sleep?
Progesterone is a big one. So as progesterone drops down, progesterone is can be a very calming, relaxing, it's an anti-anxiety hormone. The reason is progesterone turns into something else. It's called allo, not like the plant, ALLO. And allo crosses into the brain and supports GABA. GABA is our anti-anxiety hormone. It's our calming, we call it an inhibitory hormone. So women will often say, man, as I get close to my cycle, as I get close to my period, I can't sleep. I feel more anxious. What's going on? My PMS is worse. Progesterone can do that. Estrogen, on the opposite, so if your estrogen progesterone is out of balance, so estrogen higher, progesterone lower, as you get close to your period, that can cause insomnia as well. I don't generally see testosterone as the big trigger for insomnia, but I absolutely do have women that say maybe they're perimenopausal, their doctor put them on testosterone for other reasons, and they will say, and my sleep is better since starting testosterone. So we know it plays a role.
Mm-hmm.
It's not the biggest role.
But I wonder if testosterone's getting aromatized to estrogen in that situation and helping sleep. I'm not sure.
It might, or just because just have a role. It's just not very well explored.
Not well explored. Yeah.
Yeah.
Great. Thank you, Dr. Jones. Kathy, so we're going to get to all the questions. Thank you for answering these great questions. Kathy's asking, thank you for coming, Kathy. Please talk about the potential issues in perimenopause and menopause and how they relate to heart health and how to address them. That kind of gets starting to get into that BHRT type of question.
Yeah. So one of the big things estrogen does, your own estrogen that your body makes, is it really helps protect you against heart disease. We know that estrogen plays a big role in heart health, not as the same like skin health, bone health, brain health. Estrogen does play a big role. And so as women head into perimenopause and menopause, we start to lose that estrogen production, and it can increase our risk for worse heart health, just to make it easy. And so what we have found, what research is shown, is that women who go on estrogen, if they go on estrogen replacement, it could be one of the mechanisms they use to help improve heart health outcomes as they age. Now, having said that though, is estrogen the absolute only thing to heart health? Of course not. Of course not. We know that your blood, like how you handle your blood pressure, how you handle stress, your blood sugar, your diet, your sleep, your stress response, your electrolytes, your minerals like magnesium and calcium, all of these play into heart health, all of them. We look at your lipids, right? We look to see your cholesterol. We look to see your triglycerides. All of these play into heart health. And so I don't want women to think like, oh, it's just estrogen that, if I just go on estrogen, then I will magically protect my heart. It could be one of the many tools that you use, but let's pretend your blood pressure is kind of borderline high, and maybe because of the virus, you've been eating less and moving less than normal, so your blood sugar is starting to creep up there. Those are all risk factors for heart disease. So we want to make sure we first go back and address the cause, support the heart, support the minerals, support the electrolytes, and then move forward from there.
That's called the COVID diet and exercise plan, eating less and watching more Netflix, etc.
I'm sure people have heard that, it's COVID-19. And so it's like gaining, right? Gaining the COVID-19 instead of the freshman.
Yeah. Oh, the 19 pounds. Yeah. The freshman 15, the COVID-19. Yeah.
Yes.
Nice.
I didn't joke.
That's good. Yeah. And I think a lot of things, I mean, certainly with, with heart health, I often think about the garlic, like aged garlic extract too, to help some of that, and then magnesium for sure. But estrogen, we see, as estrogen levels drop in perimenopause and menopause, that cholesterol starts to go up in a lot of people. So that is something to think about. And I think we do want to get to a lot of these questions. So I do want to talk at some point today about like BHRT and like the timing and all of that, because that's an area that we should definitely talk about. So thank you, Kathy. So Kathleen's saying, I've read the directions for the Dutch test, probably have it at home. There's a 40 ounce fluid limit. Does have a history of, I believe, calcium oxalate kidney stones, shooting for about 100 ounces a day of water to, keep hydrated. Is there any flexibility in the 40 ounce limit? And I guess why is that limit? That might be...
So we're a urine test. So if you overhydrate, then urine is going to be very dilute and
dilute, yeah.
Hormones. So
Okay.
I tell people on that one day, just that one day of your whole life, I need you to really restrict your water. I tell people in Arizona when it's 120 degrees, I tell people, when the hottest place, I'm like, I know, I'm so sorry. One day, because we are a urine test, I need you to not have very clear urine.
So maybe Kathleen, do it on a cloudy day when it's not 100 degrees. So you can keep less hydrated, but won't cause you kidney stones. Yes. Thank you. Thank you, Kathleen. And then Angela asks, is there a natural way to avoid or at least minimize the impacts of hormone changes and the negative effects such as mood changes and hot flashes during menopause? This might be a time to talk about BHRT or other lifestyle changes, for hormones. I know that some studies have shown more maximal benefits for BHRT in the 5 to 10 year range post-menopause. Certain practitioners in the integrative functional naturopathic worlds tend to be more like hormones for life. I think it's interesting. So Angela, I think you mean, is there a natural way, like, do you mean hormone replacement, if you could just chat in there, or do you mean more other like lifestyle nutritional ways? Yeah, but anyway, that's a pretty big question.
Well, but we know, right? Like we both know, there are tons of natural supportive lifestyle stuff that can be helpful for menopause. And even if there aren't a robust amount of studies behind it to maybe back it up, the anecdotal feedback that we get from women, the things I see in the comments, in the groups, in the in the Facebook groups and stuff is so amazing, of people who are like, I listened to my doctor's advice and I got my sleep under control, and I started working on my stress response, and I altered my diet, and I cut down on alcohol, and I just the things that we know we should probably do as we get older, and it makes a huge impact. If you think of menopause, the transitional part of menopause, it's reverse puberty. Think of puberty, our ovaries were turning on and it was kind of chaotic. Now our ovaries are turning off and it's kind of chaotic. So that means everything that you used to do before may not work the same as you go through this transition. And so you may have to change up how you exercise. You may have to change up your sleep routine. You may have to change up how you manage stress. You may have to really reevaluate your dietary, your snacking, your alcohol, your caffeine factors, and add in, so you have herbs and IVs and vitamins and nutrients and stuff that can be really supportive as you're making this transition. On top of it, if hormone replacement therapy is the right way for you, that's an additional thing we can include as well. But remember, hormone replacement therapy is a large topic. We forget, like, thyroid hormone is a hormone replacement. DHEA, progesterone, testosterone, estrogen. So it doesn't always mean you have to go on estrogen, but it might, which is great. There's a lot of options. There's no magic. I don't have like one. It's not like black cohosh fixes everybody, because we know it doesn't. Like ashwagandha fixes everyone. Well, we know it doesn't, but for some people it can be really helpful.
Yeah.
So that's why it does take testing. It does take like a whole intake to see like what's going on, so we can
Right.
address the cause and support you at the same time.
Right. And we have in CIHS or a mnemonic called SMART lifestyle. So sleep, mindfulness, activity, real food, and ties, which are relationships. And then that, and along with that more functional approach, can be really helpful in looking at the whole picture, like you said, Dr.
I
Jones.
love that.
Thank
I love
you.
that.
And I promise this next question is not a plant. Robert asked a great question. How are the results of a Dutch test different than a salivary hormone test?
That's a great question. So a salivary test, much like a blood test, will tell you in the moment. So a salivary test will tell you estrogen, like estradiol, E2. It'll tell you testosterone. It'll tell you progesterone. It'll tell you your cortisol 4 points through the day because you spit in a tube in the morning, around lunch, around dinner, and before bed. So it's very snapshot moment. Whereas the Dutch test gives you those same hormones, but also those pathways I was talking about. So you don't get the pathways, like where is estrogen going? Where is testosterone going? You don't get those in salivary testing because you need those hormones to get processed through the liver, pushed out into the kidney, and then they show up on a urine test. Saliva doesn't go, you're just spitting out of your salivary gland. So it doesn't go through all that processing. So saliva is great if you're just looking for like quick, like I just need to know these quick hormones done. Whereas urine is way more comprehensive.
Yeah, and just an interesting analogy I was thinking as you were saying that, Carrie, is that Deanna Minich, she says in terms of nutrition, like you are what you detox, basically, right? And so
Yeah.
you can think about that in terms of hormones too. Hormones can be a double-edged sword. It can be really helpful for you, most of the time helpful, but we have to know how we're detoxing the hormones as well. We have to know the pathways, and I think that's so helpful. Even more than salivary tests, we've really used Dutch testing since 2015, since the beginning of our clinic here. We haven't looked back. We just kind of made that switch, and we found it to be so much more clinically helpful for our patients. So we really switched from saliva to Dutch testing at that point.
Yeah. And we do it actually at Dutch. We have a combination test, which, so we do use saliva as part of our urine test when we're looking at something called a cortisol awakening response, which is how fast does your body make cortisol in the morning? How fast can you get alert? How you can become alert in the morning. So
and why is the cortisol awakening response important, the CAR important here?
So in the morning, when you're sleeping, your brain is asking your adrenals, can we make cortisol now? And the adrenals are like, no, they're sleeping. Once you open your eyes and light comes in, light is the trigger, then your adrenal glands pump out a lot of cortisol really quickly in the first 30 minutes. And that's called the cortisol awakening response. That steep rise in cortisol is what helps you have energy, become alert. It reduces inflammation. It reduces infection. It manages your blood sugar because you've been fasting all night long. So we need that sharp rise in cortisol to really help get us going in the morning. A really great cheater question that I ask everybody is, how long does it take you to become alert and fully functional in the morning? And if you're thinking to yourself, well, it takes me 2 hours and 2 cups of coffee, I know your awakening response is not that great. But if you say, yeah, you know what, after about 30 minutes, I feel pretty good. I'm doing my thing. I'm, getting ready in the morning, probably have a good response. And if you say, you know what, I wake up in panic, I wake up and go right to hypervigilance. I wake up, I wake up with hot flashes because I have so much to do today, then you have a very overactive awakening.
Overactive, okay. And then if someone's dependent on coffee, if they don't have the coffee and they crash, that would also, I think, be a sign of likely their CAR is kind of being dependent on that caffeine in the morning.
Not only their CAR, their whole body.
Their whole body, yes.
They're like, like a baby bird waiting to get fed. The whole body's like, where's the coffee?
And sometimes one of the best things for the adrenal, just to see the baseline, is just to remove the caffeine, or at least if it's like really strong coffee.
Right, but be careful because we know that they'll get caffeine withdrawal and they'll filter.
Withdrawal, right? So a little bit more. I like that point you made too, Dr. Jones, about the light and the cortisol, how that stimulates the cortisol rise. So that's a really big thing, is getting out in the morning, before you go to work, before you do your things at home, getting out in the morning and really activating that pineal gland and really helping the hormone, the circadian rhythm, the clock genes, and all of that. We talked about that last week. Araceli was on here and we talked about red light therapy and Juve, and that was really great.
Yeah. Yeah, I tell people in the morning when you wake up, don't grab your phone. Don't grab that. Go, open your curtains, open your blinds.
A different type of light.
Different type of, you want real, it's called full spectrum. You want full
Yes.
spectrum light. So you want
Yes.
different sunshine. I mean, don't stare at the sun. Let's not blind you. Be smart. But like, you know, like be around it. Go outside for a couple
Yes.
minutes. Now, some people, some of you, because we all know it's getting darker earlier in the morning. So you can get a full spectrum light box or a full spectrum alarm clock that gradually brightens the room, or a light box just turn on. So I have a light box that I have no affiliation. I just bought it on Amazon. I read all the reviews. And it's about this big, like the size of a piece of paper with a little kickstand.
Can you tell us the brand? We might all go out and
It's downstairs. Otherwise I totally would.
later, yeah.
I'll email you.
Thank you.
I just turn it on in the morning and leave it on for about 15-20 minutes.
Yeah, no, that's great, especially in the winter, you know, as winter starts to come along. Thank you. So we're going to go to some other questions here. Michelle asks, what if you have a family history, what if you have a family history of breast cancer, but got tested for BRCA and was negative, and BRCA gene was negative? Is that still risky for HRT?
They say no. They say no. Not risky like we used to think. Like my grandmother died of breast cancer, and so you know, all the doctors back in the day were like, you have to be very careful. And now as we move forward, we know my mother has never had breast cancer, and you know, so far I haven't had breast cancer, and so but we know that having like one family member, and it doesn't is not the risk that we used to think. Is not the risk we think, but it is still good. I'm glad you're not BRCA, but BRCA is not as common as we think. And so it's still good if you're concerned to do the Dutch test and see where your estrogen's going, because if your estrogen is still going down that unhealthy pathway, it could still put you at risk despite the fact you don't have BRCA.
That's really important with that. Something, it's not really black or white. It's like just because someone's BRCA negative, you really have to look at the actual pathways. Kind of like if people are into this, like methylation, right? You can check an MTHFR gene, but then you really want to check maybe like homocysteine or histamine or some other, you know, some of the other tests that are out there for methylation, really see what's actually happening.
Yeah, functionally how it's like. And keep in mind, you know, cancer can happen for a multitude of ways. So we, even on Dutch tests, you know, your pathways may look great. And we have women that are like, dang it, like I still got breast cancer. I'm like, I am so sorry, but you know, cancer is a pain. Cancer's tricky. It can be triggered for lots of reasons, and it may have nothing to do with your hormones and everything to do with chemicals, right? And plastics, and you know, just other things that have sort of gone after your cells.
Yeah, things I've been listening to about breast cancer and how a lot of that is from insulin resistance. A lot of that's actually from a toxic overload, either too many toxins or the detox system is out and can't, you know, can't float out the toxins. So this is great. Thank you. And then Joe asks, you have some male representation here. Thank you, Joe, for this question. Joe's having some MCI or dementia related issues. He's taking some androderm. He's wondering about androderm. Is that going to help as a transdermal testosterone? You know, how is that, if that's going to help, how's it going to help with related to more cognitive issues, basically?
So we know testosterone in general is very helpful for cognition in men, women too, but for definitely in men, is not the end all be all, it's not the only cognition. In fact, do you watch Dr. Bredesen's work? Bredesen, right? And so he talks about when it comes to cognition, dementia, Alzheimer's, things like that, he relates it like a leaky roof, and he talks about all the holes.
6 holes, or
testosterone is one of them. And now cognitive decline just from age or from low testosterone, then of course testosterone can play a big role. And topical testosterone has been shown to be quite effective for men. Of course, just make sure you're following up with your practitioner. If it's not Dr. Wong, then definitely make sure you're getting routine lab work done. But yes, testosterone topical testosterone in men can be really helpful for that.
And again, going to that issue of, sorry, go ahead.
The last thing, just be aware topical testosterone is very transferable. So if you have a partner, if you have kids, if you have people you're touching, hugging, make sure you wash your hands after you apply it, because you can absolutely just contact to contact, give it to that person.
Just like soap and water, or just regular water?
Water, just like soap and water. Don't rub it wherever you rub it, and then, you know, turn around and touch all your counters, or touch the faucet, or grab the refrigerator handle, or, you know, go work out in your family gym in the basement, because you will then just smear testosterone that's on your hand.
Get a designated hormone replacement therapy sink or something to the
Wash
basement sink.
with water and then go from there. Yeah.
Great, thank you. Jen asked about thyroid. This is great. We love thyroid here at CIH, and I know Carrie talked about thyroid too before. Jen asked, how do thyroid issues affect the gut and vice versa? And she has SIBO, and is there any connection between SIBO and Hashimoto's?
Yes, that's such a really good question. So with thyroid in the gut, there's a huge connection. We know that like kind of everything starts with the gut, and anything, well, first of all, our gut is where we absorb. It's where we absorb all our nutrients, right? All our vitamins, everything that we need to even build for the thyroid in the first place. But on the flip side, any inflammation that we have in the gut, any, pain, infections, parasites, what have you, that is happening in the gut will directly affect the way we make thyroid, and it will directly affect the way we convert. So with thyroid, we have T4, and the active hormone is T3. T4 converts into T3 out in the periphery of our body. And so there is an enzyme that makes that happen, and it doesn't like inflammation. So the more inflammation you have, that enzyme will stop, or it will turn, and a different enzyme will basically nullify it. It can turn it into what's called reverse T3, which is inactive. And so with the gut, it's important on both ends. We want to absorb the nutrients to help us build our thyroid in the first place, our thyroid hormone, but we want to address the inflammation so that we don't reduce our ability to convert and activate into our T3.
So it's important to treat both, really, SIBO and
Yep.
thyroid, and also if there's any gut besides SIBO and thyroid too. I mean, any sort of other causes of inflammation in general, systemically in the body, might affect both of those and cause problems.
Absolutely.
Great. So we're going to go to some email questions now. One from email. I'm in my early 40s, but my PMS is getting worse and worse. I've heard taking progesterone might help, but my OBGYN said we don't do that anymore. That's an interesting, yeah. So that's interesting. Okay, that's a great question. Thank you for asking that via email.
So as women head into perimenopause, and I'm 43, so I am in my early 40s. So as women head into their 40s, what happens is we don't always release the egg every month with consistency like we used to. We don't ovulate. And when you don't ovulate, we don't make progesterone. That's the time that we make boatloads of progesterone. And then if we're not pregnant, everything drops down and we get our period. So what can happen is that as women get into their 40s, they're missing out on their ability to make boatloads of happy progesterone. And therefore, estrogen is the dominating hormone at that time. And women can feel really unbalanced, and they can feel a lot of PMS. And so it can be helpful for women in their 40s to maybe do progesterone hormone replacement. It could be an option to improve those symptoms of PMS. Now, the symptoms of PMS are broad, right? Some people have cramps, some people are moody, some people feel bloated, some people have water retention, and it's not all progesterone. Cortisol could be a big one. Brain hormones could be a big one. Stress, just stress, what you eat, just everything can really interact and worsen things around PMS. Histamine. Women who experience a lot of allergies or a lot of like itching, histamine related response, that can worsen cramps and spasms. And so progesterone's wonderful for a lot of ways, but it may not address everything. So that's why it's great maybe to see, Dr. Wong's clinic and really sort of dial in and see, is progesterone right for you, or do we need to address other things?
Thank you. And then also because on the breast cancer pathologies too, they talk about estrogen receptor and progesterone receptor. Is there any risk to taking just progesterone only, even if it's bioidentical progesterone, even at a 20 to 25 milligram, more wild yam cream versus a compounded capsule? Right. Is there any risk to that?
That's a really good question. So it's really complicated, and when you take oral, so when you swallow the progesterone capsule, what the capsule does is it goes into your intestines and your liver, and it breaks apart, and it's a term we call first pass. And when it breaks apart, it turns into other versions of progesterone. One of the versions is called an alpha pregnane is what it's called. And they're in cell studies. They're showing that the more alpha pregnanes you have, it's possible it could increase your risk for breast cancer. Okay. I have not seen human studies,
Yeah.
I've only seen cell studies on it. And we know that they don't always often transfer 1-to-1. Just because it happens in a cell in a petri dish doesn't mean that's what really happens in the body, because the body has all sorts of other ways to balance and figure out
And it is complicated, because in functional medicine we learn about estrogen dominance, and actually progesterone, to balance that with estrogen, ideally would potentially reduce the risk of breast cancer also.
Right.
Is that correct?
Right.
Yeah.
And there is some studies that also, when it comes to breast cancer, like I've heard doctors who focus on breast cancer say if somebody is PR positive, progesterone receptor positive, it's actually potentially protective. The body is trying to call in progesterone to help protect against breast
got
cancer.
it. Okay.
So
Yeah.
there's, even in the functional oncology world, it seems to be a lot of different views around
Views
this.
of that right now. Yeah. As the research goes on, hopefully we'll learn more about that.
Exactly. So I always say, and even though progesterone's over the counter, you can get it Whole Foods. Like, it's still a hormone. So please don't just slather yourself in hormone and think it's safe because I bought it off Amazon or Whole Foods or my natural grocery store, because it's still a hormone.
Yeah, I mean, just like with vitamins, and if you're taking multivitamin, taking some extra zinc or magnesium or even vitamin D, we want to check those levels. We want to see where they're at. Just like if you're taking hormones, we want to actually test to see where they're going downstream in the pathway, as well as the levels. Great, so thank you. And email question number 2, at what age can you start taking hormones to help with hormone changes? Do you have to wait until you're fully through menopause? That's a really good question, because perimenopausally, right, there's some women and there's people, I guess even on andropause, I'd be curious, to see your thoughts about that.
So I'll start with men, because that's quicker. So men have developed lower testosterone. I will say that I get really concerned when I see young men on testosterone. When I see men in their 20s and 30s in testosterone, I feel like hopefully their doctor did their due diligence and really worked them up and tried to figure it out. But unfortunately, and maybe you're seeing this too, is that they're just saying like, oh, you have low testosterone, here's testosterone. And with men, once men go on testosterone, it stops their own testosterone production and it stops their sperm formation.
Yeah.
So I have had men in their 20s and 30s start testosterone. Yeah. They haven't had a family yet. They go to have a family and it's a real struggle.
So iatrogenic andropause, essentially.
Yeah. So I do advocate for men, like, let's wait, if you're going to have a family, like, let's figure out the cause and wait for testosterone till later.
Yeah, I agree. Totally.
Yeah. Women, you do not have to wait until you're fully menopausal. So women, a lot of women, as they head into perimenopause, do start progesterone, or they'll start progesterone and DHEA, or maybe progesterone, DHEA, and testosterone. And then as they get into more menopause, then maybe if they need it, warranted, it fits their history, then they may add estrogen or some.
Right. So not estrogen in the perimenopause. That wouldn't really make sense, right? As much.
On the woman, it depends how irregular her cycles are, but a lot of women, because it's like a roller coaster, and so they generally, I generally start my perimenopausal women on other hormones if they need it, and save estrogen, because some months it's pure chaos, and then other months she goes back to normal cycling, and she's like, "What is this?" I'm like, "Oh, I know." Yes.
Great. And then Rita asked, this is an interesting question, a little interesting. A little tough, actually, I think. I'm not sure about this. See what you have to say, Dr. Jones. I've had a rushing feeling in my chest since I've had a complete hysterectomy. Rita, if you could type in when you had that and how long it's been going on. Definitely should see your doctor about that, your practitioners about that. Rushing feeling in the chest, like something is looking, it happens in the morning usually. Think about adrenaline almost there. I'm not sure, but
yeah. And the thing about a hysterectomy, if you've had a full hysterectomy, which means your ovaries were removed as well. Remember, if you weren't yet menopausal, you are now. So once you've had your ovaries removed, then you lose that entire ability to make estrogen, progesterone, and testosterone and DHEA out of your ovaries. Then you have to rely on your fat tissue to make estrogen, and you have to rely on your adrenals to make itty bitty amounts of progesterone, but of course the rest of your cortisol. So I do find a lot of women who've had their ovaries removed with a hysterectomy can really struggle, because their body wasn't expecting to go to menopause at that point, and all of a sudden, as soon as the surgery's done, they're menopausal. So I'm a big fan of supporting my hysterectomy women right away. I want to support their thyroid. I want to support their adrenals. I want to support their blood sugar. I want to support their hormones. And I do it
Yeah.
through a combination of ways.
Yeah.
Not everybody just takes a bunch of hormone. Because I know I don't want them to crash, and I want their, the glands are like, where are the ovaries? Nobody told the thyroid. Nobody tells the adrenals. We know consciously that we don't have ovaries
Right.
anymore.
The body's confused. About that.
So they're waiting for the ovaries to do their thing, and it takes a while
But
to settle
definitely
out.
talk to your practitioner about that. I think that's a good question. Thank you, Rita, for asking that. Susan, this is another good question. I'm 60 years old and in excellent health. I've been applying bioidentical hormones for the past decade, so about from 50 to 60, primarily for bone health, skin health, and longevity benefits from anti-aging. Is it advisable to continue using hormones at this point in my life?
So I'm
10
not
years
a doctor.
post.
I can't tell you what to do, but I can tell you what the research says. The research says that you can continue because of all those reasons. Bone health. The minute you stop HRT, they show that your bone health will start to decline. Potentially heart health, brain health, skin health does start to decline after stopping HRT. So they used to say, go in the smallest amount of HRT for the shortest amount of time for specific reasons. And now there's a whole bunch of write-ups saying, you know what, actually, it could be a real disservice to women to have them stop, that they could continue, because we want to reduce their risk of osteoporosis, Alzheimer's, heart disease as women age. And so now the research I'm reading and the people I'm following are saying, research says you can stay on it.
And I think it is complicated because there is that Lancet study from 2019 that was showing like an increased odds ratio with breast cancer with hormones. What is your opinion or thoughts of that?
Do you know which study that was?
I think it was from September. I have to look. 2019.
The studies. There's two big studies that get quoted a lot. That have serious flaws to them. One of them, they were comparing. I was just reading one yesterday. They were comparing, but I don't know if it's the same one. They were comparing women with.
It's a cohort study. I'll email you that.
Let's see, because the two ones that get quoted quite a bit, like the Million Women study and E3N, there are quite a number of flaws. And so once like people have gone back and looked, they were like, wait a minute.
I think the biggest thing is if you're on hormones, I mean, this is this is not official medical advice on this webinar here, but you really want to get a yearly Dutch test or some other sex hormone metabolite test to understand what the levels of hormones are, how they're going through the estrogen, the more like liver detox pathways. I think, and then obviously, and then from a functional perspective as well, looking at your gut, looking at things like beta-glucuronidase, making sure the vitamin levels are good. So all of these other things are really important, depending on the person,
Right? Like if you're going to be on estrogen and, you're concerned about breast cancer, then you need some form of imaging on the regular, whether you work with your doctor and you decide mammogram, whether you do mammogram and thermography, whether you have to do MRI, whether you do, something with ultrasound and, whatever it is that you and your doctor decide upon. I strongly recommend imaging.
With people with that still have an intact uterus, do you recommend yearly transvaginal pelvic ultrasounds too, in addition to mammogram, or?
You know what? As long as I have them on oral or vaginal progesterone, which is what the research says. So if you are on estrogen replacement, you should always be on progesterone replacement.
Right.
The uterus is what it means. And research says it should be a pill or it should be vaginal, topical count. And so far, I actually don't. I don't send them for yearly transvaginal ultrasound.
Yeah, but mammogram definitely and potentially thermography.
Otherwise, imaging. Yeah, I do
Great.
imaging.
Okay, here's some fun sex hormone binding globulin questions. So my hormones are normal, Patrice said, but I have a high SHBG, which is sex hormone binding globulin, which helps bind the estrogen to testosterone. Is that a cause for concern?
No. As long as you're normal, then your body is recalibrated itself.
You're okay, so that's good.
If you know, I would say we know we're getting bound up.
Okay, so we're going to get to round 2 here. The questions are continuing to, so I'm going to talk a little faster. Hopefully it's not too much in terms of pressure. But Michelle also asked, if you no longer have a uterus, is it beneficial to use progesterone cream?
Definitely talk to your doctor. Definitely talk, I don't know. Talk to your doctor and get and see where you're at. Yeah.
in general, there's no, I mean, that could be a possibility, at least. There's no obvious, I mean, the progesterone can be used for different things.
Absolutely.
But I will say for sleep, I mean, the pill would be better, a progesterone pill would be better than the cream based on what you said about the
Yeah,
first pass.
there's other things other than just protect your uterus.
Right. Okay, Kristen. So I'm 44, came off low dose birth control in February. In March, I was furrowed and stress spiked. I'm sorry to hear that.
Mhm.
My hair started falling out in late March and has been shedding a lot since March, much worse than post-pregnancy.
Mm.
I'm pretty upset about this. First of all, I'm really sorry about the furlough. I hope things are better overall there with you, Kristen. The dermatologist checked her scalp and said it doesn't look hormonal, but I'd like to get input on how to get it to stop and would bioidentical hormones help. She's 44. Came off a low dose birth control. I'm curious about, are you having periods? Because sometimes we know that from Dr. Jolene Brighton too, that people are on birth control, right, and then that SHBG does start to go up, even sometimes irreversibly. So that would be one question: is are you having periods
Yeah.
again? But what are your thoughts about her, for Kristen there?
So one of the big things is that I don't think people realize this. A lot goes into hair loss: cortisol, low thyroid, low iron, lack of blood flow, inflammation. So there's a lot of reasons for hair loss. But I will say, given the amount of stress a lot of people like yourself, unfortunately, are feeling in 2020, our hair follicles have itty bitty tiny HPA axes in them, and they make cortisol right in the hair follicle, and they're reactive to cortisol in circulation. What cortisol can do is it can push your hair from growing phase to blowout and then resting phase. And that resting phase can last at least, they say in research, 3 months. Like, right? That's not fair. The reason for it is when you're stressed out, your body is perceived in fight or flight and threat. It doesn't want to give nutrients, energy, support to hair growth because that's not helpful for survival, even though we love our hair. It's going to shift it to other places in the body. So what I tell people to do is, consider getting your cortisol tested or work on all sorts of things that you can, stress reduction. But we want to help improve hair follicle health. So things like rosemary oil, peppermint or spearmint oil, pumpkin seed oil, and you can just put a couple drops in your shampoo. If you do hair masks, you can rub it in your scalp. Castor oil. So I will have people mix some castor oil with rosemary oil. Be aware, castor oil is ridiculously thick and messy, but man, does it work. You can also put a couple drops of castor oil in your shampoo and your conditioner. Just keep it right in your shower and just put a couple drops in. Those can all be really right at the scalp, sort of nourishing, stimulatory, helpful at getting some of that hair to grow back. However, if it's thyroid, if it's iron, you may have to address some other nutrient issues at the same time. But what I'm seeing right now, and you guys maybe too, the stress-related hair loss is really affecting a lot of
No,
women.
it's huge. I mean, yeah, stress is definitely the other consequence of the pandemic, right? Everyone's stress levels are through the roof, and hair loss, and a lot of other symptoms, even like chest pain, shortness of breath, all these type of things. Yeah,
So
so
attend his heart math.
heart math, yes, heart math next Tuesday with
Well, support. Yeah.
definitely breathing can really reduce the cortisol. Yoga can really help. Meditation can really help. But some of these things that can help pretty instantaneously for reducing stress, because they do turn off a lot of anti-inflammatory genes when you start to do breath work. So thank you. And Tesfai, thank you, Tesfai. Thank you, Kristen, for the question. And she is having regular periods too. So it's not a Tesfai, male representation here too. What is the role of hormones in type 2 diabetes? Great question. If insulin, yes, insulin is a type of hormone. Can it be tested with a Dutch test? Now, it's not on the Dutch test, but obviously insulin affects, we know that insulin does affect hormones, other hormones too.
Yeah. So insulin is not tested on the Dutch test. Definitely gold standard is to do fasting in your blood work. And then insulin, as we know, if you have insulin, especially if insulin is too high, that it will affect that hormone I mentioned way in the beginning, 5-alpha reductase, off of testosterone. So it will increase that, and that can cause the chin hairs and the belly hairs for women. It can cause the male pattern baldness. It can maybe increase the risk for prostate problems. It can cause cystic acne, especially on the jawline. We know insulin can affect cortisol. We know insulin can affect, for women, high insulin can stop a woman from ovulating. It can reduce her progesterone and then increase her testosterone. So yes, insulin can be really, insulin not in balance can have a really detrimental effect on male and female hormones. And
Yes. And cortisol. So yeah, fasting insulin for sure. Louisa says, I'm postmenopausal, 73 years old, feel healthy, healthy labs, good heart, which is great.
Hey.
Do I still need hormones? That's a good, yeah,
No,
probably not. Yeah.
probably not.
Great.
Probably not. I mean, if you're really, if you're concerned, definitely talk to your doctor and get tested. But if you're like, I do good, feel good, everything's good.
And one of the questions also with that is, as I think as the estrogen receptors are not as active, if someone's not on BHRT, then is it even that safe to do postmenopause if they haven't started on BHRT? What's your answer on that?
If they are somebody who's way postmenopausal and wants to start it, we just use baby doses.
Baby doses, okay.
We
Okay,
just start
great.
real tiny and then work up if we need to.
Great. Thank you, Louise. It's a great question. And congratulations that you're so healthy. That's
Amazing.
great. Yes. Please share your secrets too. Yes. Great. So Pamela asked recommendations for a less than 40-year-old breast cancer survivor starting on tamoxifen for bone health and heart health.
Oh, yes. Okay. Well, unfortunately, though, that's a really great question. I don't think we have enough time because tamoxifen blocks estrogen receptors. So tamoxifen sits in the receptor, so the receptor cannot turn on, and then your estrogen gets flushed out of your system. So you're definitely going to have to talk to, I would talk to, if you can, a functional practitioner about other ways to build your bone health with exercise, with your minerals, with like your vitamin D, with things like strontium, with herbs that are known to be bone supportive, gut health, lifestyle.
Light therapy, did you ever light therapy?
Yeah, I mean, just whatever you can do to really help support these things. And that's for bone. Obviously, heart, we kind of talked about earlier. If you missed that, definitely watch the replay about all the things that go into heart. Estrogen is helpful. It's not of course, it's not the only thing for the female heart that goes into it.
Right.
So
for Darcy, for this question, because it's more of a medical, if you could just write me in the portal, go to main inbox, CIH. That's more about, just write me. I think that one is more. Thank you, Darcy. Darcy did ask that what is the maximum amount of oral DHEA a female should take per day?
So we say physiologic for DHEAs, most women do well between 5 and 10 milligrams orally. Fertility studies, women going through IVF, they'll put for women on 50 to 75 milligrams. That's a massive dose. You will be so angry and irritated. Be careful. 5 to 10 is about the max.
Okay, thank you. And then Angela asks, thank you for all these questions. These are great. And thank you, Dr. Jones. What hormone impacts your waistline as you enter menopause? Everyone, still have a regular cycle. However, the flow, look, and length have changed from my 40s. Along with these changes, I noticed a growing waistline, which I'm attributing to hormones. I'm not sure which hormone is responsible or how to get rid of this extra belly fat. That would be an interesting question about intermittent fasting there. That might be interesting there.
Well, and the big hormones are definitely like cortisol, insulin, leptin have a big impact on the belly, is the belly fat. And what happens as women age is that our estrogen, progesterone, testosterone all shifts. And then that affects whether we are or aren't insulin resistant, our receptors, what our actual fat cells do. It can change that. And so this whole shift does shift the anatomy of our fat cells. And plus it's often an age that women are, and a year that we're a lot more stressed, therefore cortisol, and we're a lot more affected by insulin, therefore belly gain. No, it's not fair. It's totally not fair. It's a terrible design flaw for perimenopause.
Have you found that in the perimenopausal or menopausal, andropausal, or someone with metabolic syndrome, that intermittent fasting would be helpful?
It can absolutely be helpful. It can absolutely be helpful. Yeah, For sure. I do recommend, obviously, people work with somebody or, read up on intermittent fasting. Don't just.
Because not everyone, if someone has HPA axis dysfunction, they're stressed, they're tired, that might not be the time to do it. And obviously, people with eating disorders,
Yep,
people
I was
that are
just gonna say
pregnant,
that.
different group, people that are growing, this stuff, all of that. And then if you're an athlete and you need higher carb or carb cycling, there's a lot of different. So talk to your practitioner about that for sure. So Kelly, this is another good question. How often would Dutch testing recommend? How often would we recommend Dutch testing to be done? I had it done a couple years ago, and hopefully this wasn't me you're talking about. This practitioner provided no treatment advice from the Dutch test. That would not be us, hopefully, but
Hopefully not.
hopefully not.
I do mine once, perks of the job, I do mine once a year, but even if I didn't work for Dutch, as a woman, I'd probably do it once a year. But for women who are getting treatment for whatever reason, whether it's they're doing HRT or they're doing other stuff, then I generally suggest every 3 to 6 months. So if you were to see Dr. Wong and get tested in October, and then he had you come back and follow up, if you were doing great, he may push it off. And if you were like, well, these things are much better, but these things are still not fixed, he may go, okay, let's retest right now and see what we're missing.
And as a general rule, we only want to order labs really, or any tests that are actionable, that thinks we're going to do something with, not just ordering it just to have it on a nice piece of glossy paper, right?
That drives me nuts when I'll see practitioners who are like, well, I order these same 56 labs on everybody. I'm like, everybody? Really?
Yeah. I think it can vary. It really can be tweaked, but I think Dutch testing can be really helpful for understanding where you actually are in terms of the metabolic pathways, and you can really do something, that's
right. The pathways are movable, which is wonderful.
Yes, they are movable, absolutely.
And they don't require, massively expensive things to move them. So that's what I love.
Okay, another SHBG question. What is the role of SHBG and how do high levels affect an individual, assuming that someone is not symptomatic? I mean, I guess if you had a SHBG that was high, but then the hormones were low, that would be a different thing. But I think what you said before was that if you have a high number, but you're feeling okay,
and your hormones are okay.
Yeah.
It's a bus. It's basically we call it a binding globulin. So for your first part of your question. So basically what it does is it's a bus that binds up free hormones so that it can't act. And then when it needs to act, it lets it off the bus so that it can get off and bind and do the hormone.
And it does go up normally, I believe, in both menopause and it seems like andropause. I'm not sure the research on that, but certainly it seems that way in terms of labs, but also with people that are currently on birth control, oral birth control pills, or they've been on birth control pills and somehow the system hasn't reset yet, then it could still be.
Yep. Oral estrogen too. Some women take oral
okay.
estrogen as an HRT.
Thank you. Yeah. So testify again, my glucose level tends to rise early in the morning before any meal. Could this be related to some type of hormonal imbalance? I mean, that does happen as part of the effect with diabetes often. And then I don't know, it might maybe probably related to cortisol.
I routinely tell blood sugar people, test your cortisol. Let's do that.
Yeah, because the cortisol will basically eventually cause that conversion of glycogen to glucose and then kind of spill off that glucose from the liver. Okay, Amber, yes, red light therapy we talked about it last week, please watch the replay, it's great. Does boost hormone levels beneficially. I think there's evidence for definitely testosterone.
I think so.
And then for the people that talk about bone health, I think it does actually help the musculoskeletal stem cells as well. So it's pretty interesting.
Cool. That's very cool.
If you have it 4 to 6 inches from your body and you're kind of getting that into there, boosting the mitochondria. I guess it can also help the stem cells. Okay, someone said totally missed the chin hair comment. I guess basically the 5-alpha reductase.
You have to go back and watch the replay.
Yes. We have a bunch of questions, so just trying to get through. Holly, let's see, headaches during the period around day 3. This month, my headache came after my period ended. What is a good way to treat the headache and ideally prevent it in the future? I'm assuming related to PMS type of.
Yeah, so headaches are often due to hormone fluctuations. So estrogen and testosterone. Estrogen's the big one. Testosterone, they've research on it too. And what it does is it affects our serotonin in our brain, and that affects our nerve, primarily what's called the trigeminal nerve. The nerve gets irritated and we get I get menstrual migraines sometimes. So
5-HTP, or what are you thinking on that?
5-HTP could be helpful. Riboflavin, which is a B vitamin. There's an herb called butterbur. Magnesium glycinate with a G, that can be really helpful. And then just whatever you can do to help with hormone balancing. So your lifestyle choices, your sleep around your period, your dietary habits around your period, your nutrients, your gut health.
Reducing sugar, alcohol,
Yep.
acupuncture too, and all
Yeah,
that.
acupuncture is super helpful. Yeah, any kind of muscular chiropractic massage. Yeah,
Maybe chase tree. Do you think that would be helpful, or
you could definitely. Chase tree is one of my
potentially?
favorite. Yeah, chase
Yeah.
tree might be helpful for sure. Yeah.
Okay. Another potentially harder question. Let's see. Have you had any experience with elevated calcium levels and elevated PTH, so almost like a primary
Oh,
hyperparathyroidism,
hypothyroidism.
resolving itself through lifestyle or detox measures?
I don't, only because that's not who I see. So I don't have experience with it. So that's probably a better question for you.
But I haven't had experience with resolving it through lifestyle detox. I mean, if it's a benign tumor like a parathyroid adenoma, then you almost have to. The only thing I can think of that might work, which I have no evidence or clinical experience for, would be red light or something where laser, I know there's some laser studies, LLLT, which is low level light, laser therapy on thyroid nodules and resolution of that. There's multiple studies on nodules. So in theory, but I don't have evidence for that. So it's something we would research more. Do brain hormones affect brain fog, brain squeeze, and stabbing? First of all, those are interesting terms. Those are new terms. But brain fog, yes. I'm sorry you're having that. Do brain hormones, and hormones are in different parts of the body too. So yeah, so it certainly affects the brain.
Believe it or not, especially as women get into perimenopause and menopause, there's a really great book called The XX Brain. And she talks about how as women get older, we need glucose to utilize what we call our glutamate pathway. Glutamate helps with executive thinking, learning, stuff like that. Too much is bad, but in normal amounts, it's really good. And glucose is the big key here. As women get older, we lose our ability to actively or effectively get glucose into that cycle. Therefore, we kind of lose out on the glutamate and we get more brain
We're
fog.
not saying to eat more baked goods or added sugar,
We're not
right? No,
saying that.
we're not saying that.
That makes it even more important to get your blood sugar balance, your insulin under control as we get older, especially because women, men too, but women, we tend to become more insulin resistant as we age because we're losing out on some hormones that are helpful for that.
Got it. So really almost a diet that will promote insulin sensitivity,
Yes.
to not have those blood sugar rises, will allow the body when someone is converting proteins, carbs and fats into glucose more, to actually utilize that glucose in the brain. Okay.
And even considering for a lot of women now, I'm telling them, like, really consider a continuous glucose monitor.
Yeah.
I don't know if you guys do.
We are starting to do that even for people without diabetes. Yeah, people are.
Yeah.
We just talked about that today, this morning. I think.
Yeah, so cool.
Yeah, it is. It is. I haven't done it myself yet, but if you have, I'll ask you that. I do want to do that. I want to try that out.
No, it's on my
It's on your list, yeah.
It's on my next thing to do, because I think it'll be really important. Now that I'm 43, I'm like, I should figure this out.
Yep. I'll do that with you. So yeah.
Let's do it. Yeah, we can report back.
Absolutely, yes. How long post? Good to see you, Dr. Sheff here. Dr. Sheff, integrative cardiologist here. How long post-menopausal HRT is safe, re cancer and cardiac risk?
So how long to start it, or how long?
I guess once you start it, sort of like the duration, the recommended duration. Yeah.
Right. So that's what we were saying earlier, that we used to say the smallest dose for the shortest amount of time for a specific symptom. And now the research that I'm reading is saying, and the people that I'm listening to are saying, if you start hormones, close to menopause, that it's actually okay to stay on it, as long as you're being monitored for all of those things. So getting imaging, right? Getting heart markers, getting hormone markers, things like that.
Got it. Thank
you. It's actually okay that once you stop it, then they're finding that some of those women are getting their bone density is going down, of course, their heart,
and even heart risk and everything.
Yep.
So Marna, Marna is one of our integrative practitioners here, and does a lot of work with hormones here at CAH. So Marna's asked, can you use Chase Tree for early perimenopause?
You can. You can use Chase Tree for early menopause. You take it every day. Yep. I don't find Chase Tree to be nearly as effective once she is skipping cycles regularly or fully menopausal. I find it's much better when there's still communication between the brain and the body.
Got it. Let's see, Babby, good to see you here too. Well, once you begin HRT, does it typically continue long term? We just talked about that. I think
Yep.
is a good hormone imbalance. Yes, diet is one of the keys to regulate hormones for sure. Talked about that. Any thoughts on Shatavari? That's from Christine, our practice administrator. She's also a
Yeah,
herbal student.
I
So
love Shatavari. It's an
Shatavari, yeah.
herb, and the I think the translation is like strength for 1,000 husbands. So it is it can be a potent herb for women. It's helpful for menopause, perimenopause. They say libido. It's not a magic for libido, but it can be helpful for libido. Overall sense of well-being. That's what they use it for a lot in Ayurvedic medicine, but you're seeing it a lot
Dr.
more.
Jones, I'm okay to stay on. I know a lot of people are still on here. I want to respect your time too. It's about 1:05. How are you doing on time?
I can do another 10 minutes till
Perfect. All right, we got 10 more
Yeah,
questions, so
cover
that's
it up.
great.
Yeah.
Thank you. Thank you. Thanks, Christine. Thanks, Marna. Okay, so Joe asked, do I understand correctly that the best thing in the morning is to expose to full spectrum light instead of reading news on the iPhone or watching TV? Yes. And then the name of the light, yes, you can email me and then we'll send
Yeah.
that out.
Yeah. Full
Great.
spectrum. Look for full spectrum.
Full spectrum, yes. Okay, Susan, good to see you, Susan, on here. Are women with a hysterectomy at greater risk for breast cancer?
Not that I know of, but I actually
Yeah,
have not looked that much into the research. Have you?
no, not that I know of. I haven't. That's a good question. So
Yeah.
we'll research that, but definitely, it doesn't. I don't
Scientific
physiologically, it doesn't
anatomy.
really
Yeah.
seem like you would. But
Yeah.
I think to me, it's about insulin resistance, like treating that, and then detoxing, like those two, and then of course balancing the hormones and figuring that out. I think totally makes sense through that.
Yeah.
Okay, so okay, 29-year-old ended birth control 4 years ago.
Okay.
If you have high SHBG and low estrogen and testosterone levels, is there cause for concern? That's where Dr. Brighton may come in there, some of those.
Yeah. Yeah. If you guys don't know Dr. Jolene Brighton, she has a great book called
Beyond the Pill.
Beyond the Pill,
Yeah,
which
Beyond
I
the
have
Pill.
right there. I
Right
was
there.
looking to see if I have it right there on my
Yeah.
shelf.
On
And it's really
Dr. Jones' shelf to the left there, yes. Yeah.
for women who are off the
Mm-hmm.
pill and looking for like, how do I get myself back in balance?
Some protocols to help. Okay, great.
Yep. And it's chapter by chapter. It's great.
Yeah, so we will ask if you'd like to, Dr. Jones, we'd love to have you on to return again at some point. We're going to try to get through as many questions as possible.
Yes.
But this is a lot of fun. So thank you in advance for joining us today.
Absolutely. No, this has been wonderful. You have great questions.
Great questions, yes. And then so Judith, thank you. Judith asked, any suggestions for managing premenopausal hormone positive breast cancer and side effects of tamoxifen? So that's kind of the whole
Yeah, and unfortunately, I'm not an oncologist or a functional oncologist.
I would recommend. So we do actually have in our practice Dr. Amina Keats, who's a FABNO. So she is a naturopathic oncologist. So please reach out to her, and that she's specialized in that. She'll be able to answer those type of questions.
That's who I would refer to.
Great, thank you. And then Pamela, any long-term effects of taking pregnenolone? So that's where
pregnenolone. So no, there's not. So pregnenolone crosses up into the brain, and it is really supportive to GABA, your calming hormone. And so that's where it's a neurosteroid. Pregnenolone can be a neurosteroid. So I don't know of long-term bad effects.
I don't either. There's nothing that's obvious known on that. Another pregnenolone question. Another person taking pregnenolone. The high testosterone, high DHEA, stopped DHEA, and numbers went down. I'm not sure this question. I don't know if I understand it, but basically, do I need to continue pregnenolone? You know what? Let's. I'm not sure if do you understand that question?
I don't know, and it sounds like definitely more practitioner question.
Practitioner, yeah. We basically want to check your numbers. We want to just look at your numbers and kind of go from there.
Yeah.
Okay, so I think we have time for a couple more. You have another minute or two, maybe?
I do, yes.
Okay, so we'll wrap. I know I tend to go a little over time on these, so especially today we have so many questions. What causes mid-cycle bleeding every month? So mid-cycle days 9 through 14. And then she put in here, she's on low estrogen, low testosterone. Okay, with a low estrogen might, but low estrogen, low T, regular regular cortisol, high Shpg. So
Yeah.
it's probably the low estrogen, right? I
No,
mean, that's
estrogen does. So when your estrogen dips down, it triggers a signal to the uterus that like to start spotting, and then if it rebounds itself, then it will stop.
okay. Well, I think we got through all the questions and time with a little extra time. So thank you so much, Dr. Jones, for being on. It's been such a fun hour here, and hope to have you back again sometime soon.
Absolutely. Thank you so much. I love talking to your clinic and everybody at your clinic.
Absolutely. Yes. Yes. It's been so great.
Thank you to everybody
Okay.
listening.
All right, Carrie. Well, thank you so much.
All right.
We'll see you later. Thank
Sounds
you,
good.
everyone, for attending. Okay. Bye.